My name is Miranda Peterman. It is October 6th at 12:45 in the afternoon, and today I'm going to be demonstrating an NG placement, meds per tube, and discontinuing an NG. I went ahead and washed my hands and got my gloves on and prepared everything that I need here on my clean work surface. I have provided patient privacy. I have also raised the bed to a working height and have the head of the bed raised. I also have got my suction turned on low, intermittent, and it is working. I have also checked my patient name. He's given me his name and date of birth. And I have a towel here in case he is drooling or spits or anything during the procedure so we don't get him all dirty. Okay, so I'm going to go ahead and start. I'm going to open my package. I'm going to tell my patient what we're going to be doing. We're going to be placing this tube into your nose, which is going to go down the back of your throat and into your stomach, okay? And I'm going to establish a sign with him. He's going to raise his hand and a stop if he can't handle the procedure, if it's too much pain, or he can't breathe at any time. I'm going to go ahead and look at the nares. I'm going to go with this one right here. I'm going to measure and make sure that I have the correct length from the nose to the ear down to the xiphoid process. And I'm going to mark it with some tape. Okay, I'm going to lubricate it one more time. And we're going to go ahead and begin. He's going to be drinking this. Okay, we're going to start with the head back. Here we go, sir. Swallow, 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 and then chin forward. Okay. Okay, and you're going to want to make sure that it's going down the back of the throat, and it is, and he can just say, ah, and it's in there. Okay, make sure that the patient is not having any difficulty breathing. It shouldn't be an excessive amount of pain. Okay, so now I'm going to go ahead and I can test placement of this tube in 3 ways. I can either insert a quick bolus of air into the stomach, and I'm going to listen, put my stethoscope right on top of the stomach and listen for a whoosh of air, or I'm going to aspirate some of the contents and check the pH, or I'm going to get a definite placement with an x-ray. Okay, so saying that I've done all 3 of these and my NG is in proper place, I'm going to go ahead and get ready to do my meds per tube. I'm going to get a bolus of normal saline, about 20 cc's. Get all the air out. Okay. All right. And prior to doing this anytime, you're going to check placement one more time just to assure that the NG is in place. And we can do that with a whoosh of air or the pH. We don't need an x-ray every single time. We're going to go ahead and flush the tube so that way the medication does not get stuck. Okay. And I've already checked my doctor's orders. This is correct. I prepared it ahead of time and labeled it. Okay. We're going to flush in between these meds. Making sure to get everything in there that you have prepared. I'm going to get a wrong amount of the medication. Okay. You're going to want to flush it one more time to get all the medication out. At least another 20 cc's of normal saline. Okay, and then that would be it, as long as you make sure that you flush your line. Then I'm going to go ahead and show you how to discontinue the NG tube, okay? We're going to go ahead and take the tape off, and this should not be near as painful as it was as insertion. Okay, I'm going to tell the patient 1, 2, 3. Take it out really quickly, and that is all. Okay, after all 3 of these events, you're going to want to document how the patient handled the procedure and note the characteristics and the amount of all the contents aspirated once hooked up to suctioning. You're going to do measure abdominal girth, assess the abdomen, and then any difficulty breathing for the patient. You want to keep the head of the bed above 30 degrees.